I'm going to switch gears then, give you a little bit of a shorter introduction to some of the traumatic stress and dissociative problems. And I'm going to focus, though there's a good bit of information, there's an appendix to this talk that has more sort of basic research data on PTSD. I'm not going to go over that because I want the focus of this to be in the connection to somatic symptom problems. And so that's really what we're going to go into through this talk. Okay. Surprisingly, only 2 medicines are approved by the FDA to treat PTSD. There are lots of medicines we use, but only 2 are approved. Okay, so we want to talk about traumatic stress dissociation and its relationship to physical symptoms, physical illness. When I touch on the criteria for DSM-5, in DSM-5, there really are going to be those that have changed from previous versions of these definitions, and in particular to those that have meaning for the medical setting. Okay, this isn't a new concept. This precedes, sort of modern psychiatry, or maybe was the basis of sort of modern psychiatric thinking with Jean-Marie Charcot, a neurologist in France, and 2 people who studied under him, Pierre Janet and Sigmund Freud. And they each went somewhat different directions with the concept of dissociation. Janet thought of it more as compartmentalization, which we'll talk about a little bit more in a minute, whereas Freud has the more familiar concept of dissociation being a splitting or a fracturing of the psyche. So the problem with dissociation as a concept is it has multiple uses. I mean, it's a normal phenomenon in some ways if you sort of zone out. You're in a room where you're working with your cell phone and somebody's talking to you and you don't hear them at all and they say, are you there? I mean, you've partially dissociated. And so it is a normal, natural process to keep us from being overwhelmed by sensory stimuli. It also is increased with various stressors, physiological ones like sleep deprivation, intoxication, and in psychiatric disorders, about 1/3 of patients that we see in outpatient settings will have at least some dissociative phenomenon. Sometimes an integral part of their illness is like the depersonalization of a panic attack, and others not quite as well formed. And then there still is the psychodynamic concept of dissociation sort of being either just on this side of the last line of defense or one step over in terms of a breakdown of the ego, a disintegration of the self. So the reason I started with dissociation is because it's making a comeback in terms of now people who are studying functional neurologic disorders thinking about it as an actual brain mechanism, not a psychological concept. And it's based on the ideas that Janet put forward a century ago, and that is that